It's the cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there is a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. And some will start to criticize, get on the show and tell pure lies, but soon they will realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. 'Cause every day everyone wanna hear from Sandra. 'Cause every day everyone got to hear from Sandra. 'Cause every day everyone got to hear from Sandra.
Good morning, good morning, good morning, K-Man. Happy Tuesday. How's everyone doing this beautiful morning? All right, let me see what's going on. Okay, I see you guys. Good morning, Island Pearl. How are you? Yeah, it says 7:30, but technically, we actually go live around 7:33. I think I've mentioned this before. In the world of radio, it's a little bit different in terms of timing. So we have to line up the show timing with radio. It's because of how they have their BBC news, I think, that comes on before us lined up. But don't worry, soon enough, we'll have our own radio station, and we can start exactly at 7:30. So we'll be making some tweaks to it. Soon come, soon come. Working on all of those beautiful things. So it's not that I don't want to start at 7:30. It's that there's a logistical reason on the back end why we start at 7:33. Just like on radio, we actually cut off at, if you guys have noticed, it's 7:29 that, 9:29 that it drops us, not exactly 9:30. So little quirks. That's what's going on. Welcome, Island Pearl. Good morning, Miss Barbara G. Plain and Straight is here in the house. Irvlyn, always here every morning. She's an A student. Shaka Zulu is here as well. Miss Sherry Coleman says, I'm watching. Thank you, Miss Sherry. And Abby, and we've got lots more. Big up to all the wonderful people there on Instagram, as well as Bobo 103.1 FM. Good morning, good morning, good morning. So it's Tuesday, so you guys know what that means. It is Medical Rundown Tuesday. So we're here with the group from the Cayman Islands, Health City Cayman Islands. So we're always really, really pleased to have them in the studio. And let's start with Mr. Shamari. See if he's got any.
Good morning. Good morning.
Good morning, Shamari. How are you?
I am good. I have no good news for you this morning.
Oh man.
The Dolphins are now 1-5. 1-5.
Wow, not a good season for them.
Yeah, but the funny part is when you have this type of season and you want the owner to fire the GM and the coach, you hope you get blown out so that there's no reason and there's no hope. But we keep playing very well against good teams and we lost at the last second by a field goal.
Oh man.
We played well
So
enough.
it's not a blowout.
No, so we played well enough that the GM, I mean the owner is still like, oh well, they're still playing well. Maybe let me give them some more time. But at this point in time, it's time to fire the GM, fire the coach, start over. We had so much hope 2 to 3 years ago when we were really good, and then it's all falling apart.
It's all downhill. Oh man, that really sucks. That really sucks.
But the good news is we're here for Medical Rundown Tuesday. So that's the excitement in my life.
As you were just talking about firing people, I was thinking to myself, Shamari better not go back in the civil service. Because he'd be demanding accountability, and they'd be like, hold on, brother, where you coming from? Because that's normally what happens, right? When the team doesn't perform, the coach is out of there.
Yeah, correct. Usually it's the coach. And after 2 or 3 coaches are fired, then the owner starts to realize it may be the general manager.
Yeah.
And typically they then would fire the general manager and bring someone else in.
New vision.
So it just depends on how the organization is organized. But a lot of times, if you have a really good coach, he may have more personnel decisions. But for the most part, the general manager at least has a lot of say when it comes to personnel. So if you're not putting a good product on the field, then usually it's the coach that goes. If you're not recruiting or drafting well from a player's perspective, then typically it's the general manager that needs to go. And we haven't been doing either for the last decade, for the most part. So both need to go. Anyway.
Wow.
Okay. We're
all
here.
Right. Accountability. I like it.
And it's great because I'm really, really happy that we're going to be introducing very shortly somebody near and dear to everyone at Health City, Dr. Dhruva, who has been with us from the beginning. He is the medical director for Health City, so he's in charge of all of the clinical staff. He's the head of anesthesia, and today is his day. Well, in 2 days is his day. October 16th is World Anaesthesia Day, and the anniversary is October 16th, 1846, which was the anniversary of the first successful public demonstration of ether anesthesia. And this year's theme is anesthesia in health emergencies. And we have Dr. Dhruva here with us, who we're excited, who has decades of experience in his area and was one of the A team that started at the very, very, very beginning, who would have been convinced by Dr. Shetty to believe in the vision of what Health City could be and what it could mean for this region. And Dr. Dhruva, I'm not sure if Dr. Dhruva knew exactly where the Cayman Islands was, or if he had actually heard about it before, but made the trek across seas to come help us build what we have today. And what's also near and dear to me about Dr. Dhruva is he is always the person who looks at, you talk about accountability, right? You can't manage what you can't measure. Dr. Dhruva is the gentleman that ensures all of the SOPs, the standards of procedure, are in place. He's the one that makes sure we have a whole system for the tracking of outcomes. He is the one that from a infection control and all of the other quality parameters that he ensures all is in order. And many times when we get either physicians and or hospital administrators who truly understand what it takes to run a hospital, that they come and they tour. So obviously you see the shiny things at Health City, both in East End and within, obviously now Commander Bay. But the one thing, anytime Dr. Dhruva does a tour and outlines all of our outcomes, all of the professionals marvel at the quality we have. And
Mm-hmm.
they always try and poach Dr. Dhruva from us, but we're not letting him go anywhere. So he has many hats, and another one that I'm really proud of is when it comes to our education program.
Mm-hmm.
Dr. Dhruva is always very involved. We got licensed to be a TVET provider for technical areas like training for phlebotomy and for medical records and for CSSD techs. And Dr. Dhruva is the medical lead for that area to be able to carry Caymanians through, to train them, and for them to have specialized positions that you don't need to go overseas to become a doctor or a nurse. All of those other areas of opportunity, Dr. Dhruva is key in that as well. So as you can tell, Dr. Dhruva is important to us, and very happy to have Dr. Dhruva on the program once again.
Thank you so much, Shamari, for that. Good morning, Dr. Dhruva. How are you?
I'm good, Miss Sandra. Morning, Shamari. Thank you. Thanks for kind words.
Yes. Well, here we're here to talk about World Anesthesia Day. And I think for one of my procedures, I've had you. I think it was the colonoscopy, right?
Correct. Yes.
Yes. And so we can talk about in a little bit, what patients can expect when they show up for a procedure. By the way, I've got a friend this morning who's having a procedure. One of our content creators, Chef Brown, Dr. Naranjan, is doing a knee procedure. I wonder if it's the keyhole procedure. He didn't exactly tell me, but I thought it might be. But let me just say a big shout out to Dr. Naranjan this morning. And of course, prayers are going up for our friend Chef Brown, hoping him, wishing him a very, safe procedure and a speedy recovery. And may he feel awesome next week, because we're back in the kitchen.
Cooking it down with Chef Brown, right?
Yes, throwing it down with Chef Brown. We're going to be recording more shows. We've had some fun in the kitchen with him so far. You guys are going to be, I think, really excited to see what we roll out for our CMR TV branding. It's a lot of good stuff, with more to come in the coming months. I think the website is just about done now. So, but Dr. Dhruva, again, welcome. Shamari, talked about your experience and your accolades. Can I just ask you a question? I'm curious. Had you ever heard of the Cayman Islands before someone walked up to you and say, hey, we've got an exciting assignment for you?
So truly, Shamari and Sandra, I had not heard of Cayman Islands, but then that is past. One of the radio show, I heard one of the school teachers say, "We are not from here, but belong here now." Not that way. So 10 years back or 12 years back, when we were offered Cayman Islands position, we had not heard, we are not very sure of where the Cayman Islands was.
Yeah.
But then,
so you were up for the adventure then?
Yeah, it was quite challenging to come here and set up the operation theater and the operations and the entire facility. But then nothing to regret. It's been a wonderful journey so far, so good. And we have looked at the quality and just concentrate on patient care as the core of whatever we do. And then if you do it with your heart, I firmly believe, and not just me, the entire group that came up in 2014, as per Dr. Devi Shetty's sort of vision, we just followed him blindly. And you would be happy to know there are 18,000 employees following him. Wow. And then we have 4,500 doctors back home, and even here in Cayman, we are nearing 60 plus full-time consultants and a few privileged consultants.
Oh my gosh. Did you say 18,000?
1,000. Yes, that's right.
Wow. So that's the whole network of people that understand Dr. Shetty's vision.
So we have 40 hospitals and embedded units across India. So we're the second largest private healthcare provider in India, which, as you know, is now the most popular. When I started with Health City, they were the second most populous country in the world. They're now the most populous country in the world. So definitely understand the size and magnitude of what Dr. Devi Shetty was able to do. And as you mentioned, somebody convinced it wasn't somebody. It was Dr. Devi Shetty who handpicked individuals, and understanding how he has been innovative and he had vision for what he was able to do in India and achieve after a certain point in time. When a visionary tells you this is his vision, even if you don't quite believe it, you trust and you take blind faith, and sure enough, everybody who took blind faith, I remember early days, they were telling me too, I don't understand it, but when he tells you it's going to happen for whatever reason, typically it happens. So
Mhm.
Yeah,
everything.
that's 100% true, Shumari. So we do around 750 open heart surgeries a day in one flagship hospital in Bangalore, from where me, Dr. Bene, all of us have come from.
Mhm.
So there, that center is doing 750 open heart surgeries a month. Sorry, and then it has got at least the
Which is
750. Let me just understand that again. You're saying 750 open heart surgeries a day
in a month. Sorry, that's it.
in a month. Oh, okay.
Yeah, yeah,
In a
yeah,
month's
yeah.
time.
which is still
That's still a lot. I
the
mean, I know I was going to say that wouldn't be possible in a day, but in a month, that is still wow.
yeah.
Yeah.
That's something
So,
else.
I mean, the group has 7,000 plus hospital beds. So, in terms of
Mhm.
whether it's a renal transplant, liver transplant, bone marrow transplant, and all of the high end tertiary care work, we've got the
Mhm.
volume. And then, just because of sheer volumes, we sort of know how the outcomes are going to be, and then they become masters in whatever we do.
Mhm.
We have a huge backing back home, and we have worked in high volume centers, and we have done all kinds of procedures, whether it's anesthesia for children, or anesthesia for open heart surgery, or anesthesia for elderly renal transplant or liver transplant.
Mhm.
So that way we learn as we do more and more numbers, and then we have sort of translocated most of our experience on the clinical team here to make sure we have good outcomes, and
Hmm.
here we are.
Wow. So, when you came here, Dr. Dhruva, I mean, obviously you had years and years of, theater experience. How does it compare as an anesthesiologist, having gone from, that many procedures, doing, procedures constantly every day in and out of the theater, to probably not doing quite as many procedures here in Cayman? Do you find that you miss the uh, pace, if you will?
So, I mean, it's you sort of tend to get the best of both worlds. I have worked in United Kingdom for a few years, and then
Mm-hmm.
we know that India is a different ball game, and the number of volumes that you see in India, you would not see that scale or scope of services elsewhere, because the volume obviously is a challenge there. But we knew very well that when we were coming to Cayman Islands, we would not see the volumes. But with whatever we see, we would have a good spectrum of cases, and then we'd be able to do justice with whatever experience we've had. So that way, our emphasis totally shifted to complete quality over
Mm-hmm.
and above what we had done in India. When the volumes are there, they're also sort
Mm-hmm.
of the delicate balance where you don't get the outcomes like what we would want with here. I mean, that is what we have achieved here with low volumes, but we have got a good spectrum. For example, we have a child who's 1 day old for open heart surgery. The very next day, we have an elderly 80-year-old man for aortic valve replacement. So that way, we have a good case mix,
Mm-hmm.
and with time, we are able to concentrate on the quality of outcomes, and then sort of fine tune a lot of our clinical SOPs and protocols to suit the local need, or local
Mm-hmm.
population. Most of the guidelines, Sandra, are written for either US or UK patient or Europe patient population.
Mm-hmm.
But then the outcomes or the numbers they say, or the sort of the data they've collected, may not be completely relevant to our patient demographics that we are seeing here.
Mm-hmm. Mm-hmm.
So that way we try to do good work with whatever we have, so that we make sure we have good outcomes here. And
Yeah.
we did have the issue when we initially came in the volumes, because we were used to operating 4 to 6 surgeries a day with different operating rooms and a lot of juniors and fellowship students. But then when we came in here, it took some time for a caseload to pick up, and also it was not consistent. The first 1 year or for 6 months to 8 months, I would say.
Mm-hmm.
That is when a lot of doubts had crept into our mind. Did we do the right thing? Was it a mistake, kind of a thing? But anyway, it was a very short transitional period. And then we got over it quite quickly, because we started getting a steady flow of patients, and then we had alliance with Haiti cardiac team, and a lot of other patients started coming from different sources, and then
Mm-hmm.
it's been good after that.
Hmm. Okay. All right, very good. Well, we're going to delve into World Anesthesia Day. And anesthesia goes all the way back to 1846, and it was considered a milestone that revolutionized modern medicine. What is the history of it? Because I mean, we see sometimes occasionally like movies, right, where
Yeah, yeah.
someone didn't have anesthesia, and it's like, oh my gosh, how is that? How is that even possible? But here we are, all of these years later. Thank God we have it, because I couldn't imagine even a tooth extraction without it. So 1846, do you know how the first physician, or I don't know if it was a physician or scientist, discovered it? Like, what were they doing to think, oh yes, this is something we can do to humans?
Yeah, so that's very true. See, before the first public demonstration of ether, all surgery were, patients would have a lot of pain. Either they would be restrained, or there are a lot of anecdotal reports of alcohol and a lot of other things being tried.
Mhm.
But the first public demonstration happened in 1846 on October 16th. It happened in the Massachusetts General Hospital's Operation Theatre Dome. That operation theater is converted into Ether Dome today. Even now, if you go to Boston, you'll be able to see the Ether Dome with a lot of oil paintings and how it happened. So
Mhm.
it was a person called Dr. William Thomas Green Morton who demonstrated the first demonstration of ether anesthesia to everybody. And then from then on, every surgery had ether anesthesia, and then sort of he could conquer the pain and agony the patients would have. So his tombstone has got a writing where before whom surgery was agony, and whose because of whom the mankind has been able to conquer pain for all surgical aspects. But that again was more than 100 years ago. Since then, the anesthesiology and the anesthesia monitors and the softwares have evolved, like the airline industry. Sort of,
Mhm.
if you compare the airline to the anesthesiology, that's how the airline industry has about a lot of checks and balances, and every time there's been
Mhm.
air crash, there are a lot of root cause analysis, and there is crew resource management about how the crew should talk to each other during a crisis, what is to be told to the passengers, what should not be told to the passenger, what is the selective sort of conduction of information, how can you be brief, what is constructive input, how do you close the loop of communication, and what are the materials, equipment, protocols, the checklist in the cockpit. For example, whether you're a 2-year experienced pilot or a 20 years experienced pilot, you still need that minimum visibility before you can land. The fuel level, the tire pressure. So there are 100 checklists that everybody has to go through to make sure the
Mhm.
journey is safe. It's the same in anesthesiology. As far as you go through all the checklist protocols and make sure you're prepared for the case, you know what is the plan of anesthesia, what are the patient's comorbid conditions, whether he's got high blood pressure, high blood sugar, has he been on treatment with what medicines, what are the interactions of those drugs. So basically, you have to be well prepared, and you should know the
Mhm.
patient's profile, you should know what surgery the patient is posted for. All the checklists are done, only then you would have a good, safe anesthesia for the patient. So I would always tell, we had a lot of students in Bangalore where I was working. So I would always tell all the students, the anesthesia can be simply terrible or terribly simple. The way you want
Wonderful.
it to be, the way you plan for it. So even simple things like colonoscopy or a procedure, it is simple from our medical point of view. But for the
Mhm.
patient, they are still having a procedure.
Mhm.
So
Of
you still
course.
have to have them fasting. You still have to do your due diligence, the pre-anesthesia assessment, make sure all monitors are working and connected. And then, Sandra, the other thing is, see, if you take away the medical fraternity point of view, and if you look at the statistics, we always tell 1% or less than 1% rate of complication. That is
Mhm.
completely from our side. But for the
Mhm.
patient, he or she might have had the very first procedure in his life.
Yes.
So for him or her, it becomes 100% incidence or 100% complication. So that it depends on which side of the screen are you when you look at statistics or the data. So that way, every patient needs the respect they need to, because they are having a procedure, and you have to be careful with every monitors, every
Mhm.
whether it's a slight change in blood pressure or heart rate. Ask why. Don't ignore any monitors or alarms, and make sure they have a good, safe procedure, and then they go back home the way they came into the hospital.
Yep. And I think that's, I mean, it's a fear, I think, for everyone who's ever had a procedure, like, oh my God, what if something happens? And we'll talk about the importance of the patients following the medical advice that they receive, because obviously that's critical. But the theme for this year's World Anesthesiologists Anesthesia Day is anesthesiology in health emergencies, highlighting the vital role that anesthesiologists play in saving lives during crisis situations. So it's important to remember, and this is kind of the focus for this year, is that it's not just like, oh, I've got a scheduled appointment where I know in the morning I'm having surgery, so I can fast, I can do this, I can do that. I've always wondered this. I think this is a great theme. What happens when you have an emergency, an accident, where that patient hasn't had the benefit of fasting or a pre-consult or any of that? They just are presented to you and you don't even know what their weight is. Like, how do you handle? And I guess this is where your training comes in for your entire anesthesia team. But how do you handle these kind of rapid decision making situations where you're under pressure to put the person under to have emergency surgery?
So that's very true. So right from your training to you will have a lot of things going on simultaneously. So you will have to run through the patient brief history, because you will also not have enough time to assess them like how you would do in your office when they come in.
Right.
Before the surgery, like an elective procedure, you have enough time to work them up and then make sure it is safe for them to have a procedure. But here, the decision is taken in minutes or seconds, so you will have to assess the patient fasting, whether they have dentures, what allergies they have, what a brief history you can elicit, you will have to get that in. And a lot of things are decided by how stable the patients are before the procedure. If it's going to be a motor vehicle accident, or if it's going to be emergency cesarean section where you don't have much time, then you try to pull in your socks and then you try to do whatever is the best for the patient. But again, the safety of the patient is always at the core. You don't compromise patient safety by rushing it through. So you will also know by experience when to slow down or when to sort of go as per what is needed, based on whether the patient's oxygen levels are fine, blood pressures are fine, and then based on what area the patients have had injury. If it's going to be a road traffic accident involving the spine or abdomen, you also are conscious about what CTs need to be done. Whether there's a great vessel injury, do you need enough blood? Do you have enough blood organized? If you don't have time for blood grouping and cross matching, we just give the universal donor blood group. So all of this will run. And again, consenting, would you have any family to consent, or can we do telephonic consent based on the patient safety or life or threat, and then you try to mobilize that. So that way, again, one is your experience and what you've studied. And we also do a lot of mock drills about a crisis in war, whether it's emergency C-section or it could be local anesthesia, systemic toxicity, or polytrauma. How do you handle? And we also do a lot of codes on the massive blood transfusion protocols. So everybody's aware, right from the lab technicians to the blood bank technician, to mobilize and then to send you the blood that you need. And the CPR BLS is always part and parcel of any organization. So we do have BLS drills in the operating room, and then we make sure all the team are completely on par with the recent guidelines, and they have refreshed all their BLS, ACLS skills. We also do something called difficult airway simulation in the operating room, so everybody knows how to handle a difficult airway and what our equipment are needed, are there when you need it the most. So another thing in the operating room, Sunrise, like the airline industry, we look at the ergonomics in the operating room, where the environment can be quite stressful when you have emergencies or crisis in the operating rooms. So I firmly believe that everything should have a place and everything should be in its place. So that's one way to reduce our stress when you have emergencies or unanticipated difficult airway or unanticipated difficulties. you should know where your stuff are, and everything should have a place. So if you want a laryngoscope, or if you say you want a particular drug, it all should be in order. That is where the importance of checklist comes in. So there is somebody assigned to check all these drugs equipment, that they are in their own place and they are working, so that when you need it, you have a working equipment. Yeah, and like Murphy's law, the day you will not check that is the day you will need it the most. And then I
Wow.
always tell, when we set in protocols and checklists and SOP, it is not for us in the senior management or for Joint Commission or for any accreditation. We
Yeah.
are not, it's not about fooling each other. We probably are doing something which will affect the patient's safety and life. So that is where the checklists are very important. And I
Yes.
also realized as a manager that when people don't do what they have to do, you sit them down, have a discussion with them, and explain to them the reasons you're having the checklist. Then the reasoning helps, and then they also understand why we are doing what we are asking them to do. So that way the compliance to our checklist are a lot better, which obviously will affect the patient outcomes, and then it will help us. It could be simple things like hand hygiene by healthcare worker, or it could be safe medication management, or to check the airway card, laryngoscope, or the drugs in the operating room, defibrillator. So all of this has got a bearing. And in emergencies, anesthesiologists are a core member of any emergency team, whether it's a code blue team for CPR or medical emergencies or polytrauma in the emergency room or in the operating room. So that way we are there where it is very important to help the patient.
And it's so interesting that despite anesthesia now being available nearly 170 years after the very first procedure, 5 billion people still lack access to safe anesthesia and surgical care. That's shocking to me. I can't even believe it.
Yeah, I mean, it is true because it is skewed sort of more towards the Western world. So you still have Africa and a lot of third world countries where even basic work, not high-end tertiary work, even like if you have a basic pregnant lady who's going for surgery or for LSCS or cesarean section, the maternal mortality or the infant mortality is still high. So there are a lot of preventable things we could do, or it could be waterborne disease or a safe operating room to do a very small surgery or a very minor surgery. So all of these things are lacking in a lot of places. So that way, a lot of organizations are trying to send in teams to Africa and other places to support, and then to make sure kids or patients have safe surgery.
Yeah, it's shocking to know that it's still that many people around the world. But the World Federation of Societies of Anesthesiologists try to highlight a specific theme each year to showcase the diverse and essential roles that anesthesiologists play in patient care. And don't forget, folks, if you have a question for our guests, they're here every Tuesday. The phone lines are always open, 936-2626. Island Pearl says, I had a tumor removed last November. And let me tell you, anesthesia didn't agree with me at all. It makes me extremely nauseated, and other people I know have no effect from it. So let's talk about this, because this is actually one of the known side effects. Island Pearl, don't worry, it's not that uncommon. And that's one of the reasons why after procedure, they ease you into eating anything, because they know that as you're coming out of it, especially within the first 24 hours, 12 hours probably is the most high risk, you're likely to bring everything up that you've taken down. So isn't that right, Dr. Dhruva? You have a process of assessing whether or not the patient can actually have anything to eat without bringing it back up and being nauseated.
Correct. So this post-op nausea and vomiting is a risk for a few patients. It's not that everybody will have the same complication or the side effects, and it also doesn't mean the same patient will have the same symptoms recurring every time. So it depends on what procedure patient is scheduled for, and it also depends on a lot of factors, from painkillers that we use to what gases we use, and also the patient's inherent vulnerability to have nausea and vomiting. all of this has got an effect. But if we do have this history that patients have had nausea, vomiting in the past surgery, we try to add in drugs or make some changes so that their nausea and vomiting are completely controlled or at least reduced to a significant level. And it also depends on what procedure they are scheduled for. If it's a body cavity surgery or a major surgery, like what this particular patient had a tumor removed, obviously it's going to be a major surgery. And again, whether it's done laparoscopically or robotically or open procedure, again, it's got implications, because if we do lap or robotic surgery, the pain will be much lesser. So when the pain is much lesser, the drugs used for giving pain, analgesia or painkillers, also the dose would be less. Whereas if you had an open surgery where you got a big cut on your abdomen, then obviously we'll have to take care of the pain. We do try to reduce the painkillers which can be given systemically or intravenous. That is called opioids or opioid sparing surgeries. We try to use other modalities. So you could use an epidural catheter or a nerve block catheter. We also give a block on the abdominal wall to take care of the nerves which supply the abdominal wall, called TAB. All of this will help with the pain management. So obviously we do reduce the dose of narcotics and other things. The nausea vomiting effects also comes down. But again, every patient is different. For example, some patients may have allergic to certain group of drugs called NSAIDs, where we are not able to use them. Or certain patients would have problems with their kidney, with kidney dysfunction. There again, we cannot use all the drugs which are in our armamentarium. So that way, this is where the pre-op assessment helps us when we examine the patient, assess them, and sort of elicit their history and past history. What are the issues with the past surgery and anesthesia? We sort of tend to draw a plan of anesthesia for that particular patient, and we counsel them. That would be plan A. But we always have a plan B in case there is an issue with that, or it doesn't work well, or we are not able to do it. What is the next plan of action for them is always charted there. Yeah.
And then, part of the pre-op includes the blood work as well, right? So that you will know if your client or your patient, my apologies, might have any specific issues in terms of like heart function. You do the ECG and different things to kind of alert you as well.
Correct. So see, a lot of patients may not be aware that they're having high blood sugars, or may not be aware that they're having low hemoglobin. So a lot of these things are picked up by the blood work that we do. And also in patients who are diabetic, it would give us a range of how their blood sugars have been 3 or 6 months before the surgery. So that sort of helps us plan the surgery, because with uncontrolled diabetes, wound infection is always a risk. So we would want to make sure there is no wound infection and everything goes well. At the same time, a lot of women in the sort of reproductive age group can have low hemoglobin. So when we accept them for major surgeries where they're going to be considerable blood loss, we again would want to make sure we have enough blood reserved and make sure their hemoglobin is at least 10, 11, 12 or higher before we accept. And if it's quite low, we usually defer the surgery if it's an elective procedure. Unless it's a time-sensitive sort of malignancy or cancer, we are working them up, or something which is time-sensitive. If it's a planned elective, we usually try to defer it, give them some hematinics, build up their hemoglobin to get their hemoglobin up. And a lot of times they are not aware of why they are having anemia or low hemoglobin. So it also gives us an idea to work them up. Something which we can do or work them up for.
Okay, let's do a quick traffic alert, folks. We've just been notified that there's a 4-car accident on Barabanu Road, that's West Bay, before you get to the bypass. So if you were leaving out of West Bay, sort of later this morning, and you have options to avoid that area. So this is Barabanu Road. Before you get to the bypass, there's a 4-car accident. Please see if you can reroute yourself and perhaps go the other way and take, go down by the 4-way stop to see if you can avoid that specific area in the bypass. So West Bay, expect some traffic. I know Savannah had some this morning, although I did not hear about an accident out of Savannah. I did get reports that traffic was backed up for some reason. So make it safely into work, folks. And in the meantime, we're here to keep you company. right here on the Cold Hard Truth with Medical Rundown Tuesdays. So we talk about all things anesthesia today. It's a very long word, doctor. And it gets longer when they add on stuff onto the end, But yes, anesthesiologists are not only responsible for putting patients to sleep before surgery, but they have the very, very critical role of, being trained to manage life-threatening emergencies, trauma, cardiac arrest, emergency surgery, and they help to stabilize vital functions like your breathing, circulation, and pain control. They work closely with emergency and surgical teams to ensure patient safety from the moment of crises straight through to recovery. Now, I've had a few procedures done. I'm still surprised, Shamari. I think you're one of those people. You've never had any surgeries done? You haven't been put under?
Nope, no surgery. Knock on wood. Even with all my basketball and football playing days back in the day, never had any serious injuries. Pulled my groin once, which was very painful, playing football, and had to be out for a few weeks. Broke my tailbone.
Wow.
But that was after. That wasn't playing. That was rushing down some steps in St. Lucia to get to a meeting and having my laptop in one hand that went flying because of the morning dew. I grabbed the laptop and landed square on my bunkie and skid down.
That's gotta hurt.
And
how do you fix a broken tailbone?
You can't. You just have to. You get the donut.
You let it.
You get that donut. You have to rest and you get some painkillers, and there's no surgery. So
my gosh,
I've been blessed that I haven't had to have anesthesia. So I'm one of, I guess, the lucky ones. I mean, knock on wood. And even though I work at a facility, that's why, at times, if I'm here speaking about it, then I need to go get my executive health checks and make sure I'm seeing a doctor regularly enough. Just because I typically don't have to go to see doctors or anything. So, I just have to
keep watching your numbers.
Definitely. And just that I remember when Dr. Dhruva, who's a part of the anesthesiology society here in Cayman, one of the founding members with Dr. Jefferson and other great anesthesiologists. And I had to go just to give a welcome. And I remember looking at different analogies, and there was it was a little bit of a story, right, about a king that needed to build a bridge to connect two kingdoms. And obviously you had the architect. These are the sexy things. You have the architect, you have the design work, you have all the laborers who go and build the actual bridge, and the bridge held up for decades, and there were no safety issues. But the one thing they didn't realize, that there was a gentleman who used to go and check the tension in the wires every night when everybody was sleeping, used to go and make sure all of the planks were steady, and just likened it to that's the anesthesiologist, right? The sexy types of jobs are, the actual physicians that you'll see who are actually doing the surgery, and obviously the nurses that take care of you afterwards. But the anesthesiologists are the ones who do the quiet work that are as important as anyone else in that patient journey, whether it's putting you to sleep, waking you up, making sure your vital organs are still working during the procedure. So they are the heroes that do the quiet work that a lot of people don't realize how impactful and how important they are. And just to say that, obviously we're thankful for the entire team, but being that it's World Anesthesia Day, I think it helps to highlight the importance of anesthesiologists to all of the surgeries that we would undergo. And I haven't had the pleasure of having surgery as yet, and I hope I never have to. But if I do, obviously, you're going to be in great hands, whether it's from the surgeons to obviously the anesthesiologists and the team that make sure that you're going to be better on the back end as well.
Wow. Truly amazing, Shamari. You're in a category of your own, having not had any procedures yet. I feel like eventually. Oh, but wait a minute. So that means you haven't had a colonoscopy yet either. Oh, soon come.
Yeah, soon come, soon come.
That
I've
will be
never
your
I've
first.
never gone under, but I trust
Yeah,
Dr.
so
Silva.
that will be your first
Yes,
procedure to go under. Okay, all right, you're good, and you're getting to that age now.
I am. I'm right there.
Yeah. But having
See,
had the experience,
Dr. Sukian retired, and Dr. Suki had been my GP for decades, and
yeah,
she would be the one that would be on top of me. But now I have, Dr. Tarun and Dr. Sandeep that are on top of me. So
yeah,
yes, soon
and
come.
and pretend Dr. Sandy, I'll be watching you too. Make sure you get it done. It's very, very important.
No, definitely.
Dr. Dhruva, I've had a few experiences, and the first time I had a procedure, I was surprised. I don't know if it was the particular cocktail that they gave me, but they had a little bit of an issue actually waking me up, is what I found out later on. And in fact, I remember waking up in the recovery area feeling
Sure.
extremely hot. Like I was like, oh my God, I felt like there was a fire is burning up. And someone who was visiting me went and mentioned it, to the nurses at the HSA. And I think they must have, I felt like they must have put me back under, because I just remember going back out, and then I eventually woke up in the some hours later. But it was quite a long procedure, so maybe it was what they were keeping me under with. But all of these things matter: the length of the procedure, the type of the procedure, looking at specifics in terms of your patient. And then other times I feel like I didn't have an issue, but it was probably because it was a much simpler procedure and I wasn't really out for that long. So say, for example, the colonoscopy is not really a serious procedure, especially if they don't really find much. They find one or two polyps that they just take off at the same time. So how impactful when it comes to what you do is the actual length of the procedure? I imagine it does matter quite a bit, right?
Yeah, that's true. So I'll cover this in two parts. I think the first part, just to comment on what Shumari told. See, most of us as anesthesiologists are the people behind the scenes, or with masks. So whether it's an open brain surgery that we have done at Health City, or a lot of surgeries for Dr. Benoit's open heart surgery, whether it's the children who have done well, or we have given CPR for up to 90 minutes for a few patients, and then we put them on ECMO, and then subsequently we have sent them home. So there again, with CPR to anesthesia to ICU management, anesthesia team has been there to take care of the patients and support the entire team. Same way with all the orthopedic work that we do, whether it's Dr. Niranjan's case with knee replacement, hip replacement, or magnetic limb lengthening to lethargist procedure for shoulder, anesthesia team has always been there, as a bedrock for all the procedures that we do. Same way, we are an integral part of the Code Blue and the emergency management team, whether it's an epidemic disaster, the Code Blue infection control, or mock drills in the hospital. And we are involved actively with a lot of academics and teaching programs, whether the basic life support or the CPR training of the entire hospital staff, the advanced cardiac life support, the pediatric advanced life support. It is the anesthesia team, which is one of the sort of linchpin to manage the trainings. So we are there in most of the surgeries, in emergencies room or the ICUs, to take care of the patient, and we also take care of the pain management of the patients post-operatively or after surgery to make sure their pain control is adequate. We make sure they make a good recovery, so that way their pulmonary rehabilitation in the open heart surgery, or if they have knee or hip replacement, their range of movements and their mobility is got back as soon as possible, so that they have a good discharge and then they have a good physical activity. So that way we are there in most of the work that we do and make sure the patients have good outcomes. So that was the first part. The second part, what you asked again, see, we have guidelines and we have doses for different age group, whether it's children, adults, and so we know what is the doses are, like range of doses, but again we base it on a lot of physiologic response of the patient, whether it's the eyelash reflex or how the hemodynamic parameters go, whether the BP is coming down, the heart rate is slowing. All of this gives an idea directly and indirectly about how the patient has behaved. And again, we titrate the drugs to the response that we would need. For example, in colonoscopy, we don't need heavy or deep sedation. It's not a painful procedure, it's just a discomfort that we are trying to numb and make sure patients got a comfortable procedure. So we try to get a point or a sweet spot where they are fairly under sedation, they're not moving and they're not tossing around. At the same time, the procedure is done. Whereas if it's going to be a surgery on the brain where you don't want the patient to move at all, so we try to have a very intense depth of anesthesia to make sure everything is fine. Same way if it's going to be an open heart surgery or a surgery on the eye, where we don't want any movement at all. So the depth of anesthesia, again, we monitor the depth of anesthesia with different monitors that we have to make sure we've got the right depth of anesthesia to have the procedure done. There again, when we have such higher depths of anesthesia, their recovery time also is going to be delayed, or they're going to wake up a little slower than normal. And again, if you have two patients, one say is a 30-year-old young patient with no comorbidities, and the other one is say 80-year-old patient with the same depth of anesthesia, 80-year-old is going to wake up a little more slower than a 30-year-old younger patient. So these are analogies just for you to understand. Again, if patients have other history of smoking or a lot of other drugs they're taking for painkiller, if they're taking a lot of morphine and other things for knee joint pain, again, a lot of painkillers that we give may not work on them as well because they're already on a good dose of painkiller. So we'll have to look at alternatives or try to go at a higher dose of these painkillers to make that surgery painless for them. So that way every patient is different, but we gauge their history and what medicines they're taking, what is their threshold for pain, and then what is the history of nausea, vomiting, whether they've had any adverse event during anesthesia surgery before, and what procedure are they planned for. Based on all of this, we counsel the patient whether they're going to be in the ICU after surgery or we think they can be managed in the ward where they'll be comfortable, pain-free, no nausea, vomiting, and it's easier for them to sort of take care of themselves and the nurses in the ward to take care of them. But if you have any doubts based on all of these things, we normally do not transfer the patient back to the wards. From the recovery, we usually have them in the ICU for at least a longer stay or overnight to make sure they're completely fine before we could transfer them to the ward.
Yes.
So,
And you mentioned, the fact that things that the patient may be doing. So when I know in consults, you'll get questions like, are you on any medications? Are you taking these supplements? Because all of these things matter. And there's one thing that you said that I know from my own little amateur research has a real impact on someone's recovery time, how they perform during surgery, and even how they may be impacted by anesthesia. And that is smoking. So tell us why smokers have such a different response to surgery and, certain drugs and stuff like that. What is it about the act of smoking that makes your job a little bit more challenging? And what can patients do who are smokers before they go in for procedure, if it's a planned procedure? Obviously, we're talking about emergency procedures today, which, they might have just had a cigarette right before they had the accident. But what do you adjust and what can patients do if it's a non-emergency situation?
So that's a very good question, Sandra. See, smoking is bad for lungs and it is hazardous for health. So it's very simple. And the longer they are smoked and more cigarettes they have smoked, we consider something called back years. It's got an adverse effect on the surgery and the lung health. So smoking, chronic smoker, meaning if they have smoked 10, 12 or more than 10, 15 cigarettes a day for many years, 10, 15 decades, they are more than 11, 12% higher chances of having post-operative pulmonary complications. So if they do have any chest surgery or open heart surgery or abdominal surgery, body cavity surgery, where they are on ventilator for some time and then we have to take them off ventilator, the lung complication rates are definitely higher. So the other sort of very simple terminology, if I have to tell, the smoking affects the hemoglobin levels. So the carboxyhemoglobin level builds up. So basically what happens is they bind to oxygen and they don't allow oxygen to be transported to the cells.
Mm-hmm.
So that way the oxygen delivery to the cells at the cellular level comes down if you have been smoking actively for a long time. So that way studies have shown that even 2 or 3 days of smoking cessation before surgery helps in oxygen delivery or increases the oxygen delivery to the tissues. So that way the surgical outcomes may be better. But again, if you take the other
Yeah.
extreme where people who have been smoking for 10, 15 years, it is impossible for them to quit smoking overnight. So if they do end up in the surgery or if they end up in the ICU after a sort of emergency surgery where they have not had time to quit smoking, they have a lot of symptoms or withdrawal symptoms because of nicotine level coming down in blood. So we do put nicotine patches to manage their agitations in the ICU and to make sure their recovery in the ICU is a lot better. Otherwise, they're tossing around trying to pull out the tubes, lines, and they don't cooperate with the healthcare workers to that's a physiotherapy or mobilization. All of that becomes an issue. But in short, if they are for major lung surgery, at least a few weeks of smoking cessation is definitely good. And it's a double-edged sword because they've been smoking for a long time. They've had lung cancer. And we are trying to do a curative lung surgery to help them recover. And then if they are not stopping smoking, then obviously the recovery from the surgery will be affected. So for all lung surgery, we definitely would want at least a few weeks. And for any surgery, it's ideal to have at least 2 to 3 weeks of smoking cessation. But even 2 to 3 days of smoking does help in increased oxygen delivery to the tissues and cells, and the wound healing is better. So we'll be able to manage them well. But it's a bigger topic, smoking and surgery, smoking and anesthesia. It depends on what surgery they are scheduled for. How's their baseline function been, that way. So there's a question, is this the same for person that vape? I think the physiology is almost the same. If you've been vaping or smoking for a long time, obviously your oxygen delivery will be down. And whether it's vaping or smoking, it's usually not healthy. It's not good for your lung function and for your overall well-being.
Yes. And so I'm glad you answered that because Island Pearl said, is it the same for vaping? So just to clarify, there's zero evidence that vaping is any different or any better than traditional smoking. And in some instances, it might actually be worse.
True.
All
and
right.
I mean,
yes.
there again, Sandra, what you told is 100% true. Vaping, you probably after 20 years, we'll be talking about the deleterious effect of vaping. The information is less, and also studies may not have had enough time to review long-term the effects of vaping on health.
Yeah. Don't take a chance, folks. It's certainly not going to be worth it. The early reports about the irreversible damage it does with the popcorn lungs and so forth just doesn't make it worth it. Wendell joining us from Turks and Caicos. Good morning. Yes, that's beautiful. Another beautiful island. And we have Raquel joining us from Belize. We've got our international folks tuned in this morning as well. So, the entire Caribbean and the world gets to hear about Health City Cayman Islands right here on Medical Rundown Tuesday. And we're talking about Anesthesia Day, which is coming up in a few days this week, and all things really anesthesia. But the theme this year is about anesthesia in emergency situations. So, lots of advances in public confidence in healthcare, knowing that procedures can now be done safely and pain-free. Again, Dr. Dhruva is an anesthesiologist, but Dr. Dhruva, you're just one. I know you maybe you're the top guy there, but you're a part of an anesthesiologist team because I have met some of your other team members. So when I had my knee surgery the other day, I swear there was at least 3 guys in the studio with me. I don't know if they were all anesthesiologists, but I assume they were. And they were all there taking care of me to make sure that I was being put under safely because they were looking for that. I have very elusive veins. So they were looking at where to put the entry point. And one of them had blue eyes. I remember him because of his unique blue eyes. But because, you don't see many Indian people blue eyes, I must say. He's got a very unique set of eyes. But yeah, no, I was thinking, wow, I get 3 of them at one time. Are those all anesthesiologists? Or are they like anesthesiologist assistants or?
So that's true. Your observation is correct. So I have a big team. We are 8 of us, 8 anesthesiologists in Health City. We take care of both Kamana Bay and Health City East End.
Yes.
And we also have 8 anesthesia technicians or assistants who help us with patient positioning, IV line preparation, and setting up the operating room for us. So we work together as a team. So, for example, if it's a knee surgery, we know how to position, or if it's a back surgery, we'll have to, after we anesthetize the patients, we'll have to flip them around to have the back operating side of the back. So that takes a big teamwork. So apart from the anesthesiologist and the anesthesia tech, the OR nurses also pitch in to support us in the operating room. So what you would have seen is probably a team where anesthesia and anesthesia techs are there. And like your observation about ultrasound is true. Ultrasound has ever revolutionized sort of the anesthesia care and the nerve blocks that we do. So it's a standard one care, and we use ultrasound for all difficult IV lines, or if it's going to be a central line access or regional blocks. We use ultrasound quite extensively in anesthesia department.
Yeah, well, I had no idea because that was my first experience where I know I have difficult veins to find, but normally they eventually find one. But that time it was just elusive. Like I've never seen anything like it. And thank God they brought in, Dr. Benoit said, we're going to bring in the experts for you. And they said, you know what, we're going to bring that ultrasound machine in to hunt for the vein because they move around. Who knew?
Yeah. I mean, the bigger ones and the portable ones, so we can move them around to.
Yeah, no, I meant the vein. The veins seem to move.
Yeah, sure. Sorry.
Yeah, they jump around a bit. So mine were not having it that day, but thanks so much to your staff for being able to get it done. So again, modern anesthesia, folks, has become safer than ever before with innovations in monitoring systems, airway management, and drug delivery. Like he said, they've got a huge team there. That must be the biggest team of anesthesiologists on island for sure, using advanced technology to ensure that they provide precise real-time patient management and care. And then rapid response protocols and simulations based on training prepare their teams for any emergency, ensuring that the best possible outcomes can occur even under pressure. And of course, Shamari, we should remind people that you guys are is it level A or level 1 trauma center? You got to remind me. At Kamana Bay, you basically equipped and licensed and ready for all and any emergencies.
Yeah, that's correct, Sandy. And as you can tell from our specialist area, we have practically all of the specialists at the highest levels, whether it's from a cardiac perspective, neuro perspective, orthopedic perspective, and then obviously emergency doctors and the such. So we're fully equipped that if there's an issue, we will be able to give best efforts towards saving lives as well as giving better quality of life. When it's a heart attack, when it's a stroke, if you get to us quickly enough, and if it's the right type of stroke, for instance, a Dr. Ramesh can go in minimally invasively and extract clots to reverse the effects of a stroke and the such.
Fantastic. Wow. I'm always in awe of modern medicine. I got to tell you the truth. So anesthesia excellence at Health City, Cayman Islands, again, playing a central role in medical emergencies, trauma cases, and critical care. They're part of a response team that's available 24/7, as you have to be, for any sort of trauma, cardiac, and neurosurgical emergencies. And through their international training and collaboration, their team stays focused on the forefront of best practices in emergency anesthesia and patient safety. Dr. Dhruva, thank you so much for joining us this morning and reminding us as we approach, World Anesthesia Day about the important role that you and your team and all anesthesiologists all over the world really play, because I can't imagine, even with my knee, I'll tell you, when I had the keyhole surgery, having that nerve blocker put in there, the first couple days, like the first week, I was like, oh, I'm not feeling any pain. I'm feeling great. So, it was thanks to that nerve blocker. So it's like little things like that the patient doesn't appreciate until you have it done. And then you're just like, wow, this is great.
Yeah. Thanks, Ms. Sandra. Thanks a lot for having us. Before I go, one last point. We, as anesthesiologists in the country, Cayman Islands, have gotten together. So we have a society called Cayman Islands Society of Anesthesiology. This is the first formal, recognized, registered society of specialists anywhere in the Caribbean, or probably in the Cayman Islands. And we are the only association in the Caribbean who's associated with World Federation Society of Anesthesiology and SAMBA.
Mm-hmm.
So from Dr. Jefferson, me, and all the anesthesiologists in the country are together, and we do have our quarterly meetings and scientific discussions. We hosted our last conference, May of this year, we hosted the first inaugural conference. We're going to be hosting another conference next year to get all the anesthesiologists and emergency physicians together for discussion in the Cayman Islands. And next year's theme is going to be anesthesiology emergencies, what WFSA is quoting. So that will be our theme for the next year.
Mm-hmm.
And
Fantastic.
happy World Anesthesia Day to everybody, the viewers, Shamari, you, Sandra, everybody. Thank you. Thanks a lot.
Thank you so much. Thank you, Dr. Dhruva. Thank you so much. Shamari?
All right. Well,
another one under our belts. And I know Dr. Dhruva probably has several surgeries that he's got to run into today. So we didn't want to keep him too long. But they do really an amazing job, I must say.
Mm-hmm. Amazing topic. And obviously, I'm not going to say that you can call Dr. Dhruva for an appointment, because
no.
You wouldn't need him for an appointment. He'll be there when you have an appointment with someone else for
an emergency.
He and the team, or the emergency area. So, yeah, as you know, we just like to bring topical topics every week. And the fact that World Anesthesia Day is October 16th, we thought it made sense to bring Dr. Dhruva. Now, he does so many other things as well. So we'll definitely have him on the program in a different context later. But great show. And thank you, Sandy, as always. And looking forward to seeing you next week. And it will be it's going to be the battle of which head coach is going to get fired first next week, this Sunday, because we're playing the Cleveland Browns. They're 1-5. We're 1-5. So
the worst of the worst playing.
We're going to be 1-6. So yeah.
So whoever loses, they're definitely in the chopping block. Thank you so much, Shamari.
All right.
Appreciate it. Have a good one.
Bye.
All right, folks. That's not going to be. Well, we'll get the update from Shamari. He's our sports commentator. I need to get him to do our sports show for me on CMR TV. I've not been able to get a sports person yet, but listen, someone was saying to me yesterday, oh, Sandy, I didn't know that you guys were doing all this with CMR TV. And I said, you got to keep up. They apparently were a little insulted that we did a video. Did you guys see my video in Tagalog? Tagali? Might be mispronouncing it. For a Filipino community. So they were insulted, but I'm going to play you all the video. And then I'm going to tell you all something about this sort of thing, because you don't need to get insulted. You don't need to get up in your feelings. And I'm going to tell you why I don't really care if you do, because I sit here every day, like I said, and I fight for inclusion. And you can't ask people for them to come here and adopt, all things Caymanian, and then you're not willing to learn a little bit about them. So check out this video. I actually love the video. Check this out.
Panapanabik oras ay nangyayari dito mismo Cayman Mile Road at gusto naming maging bahagi ka nito. Naghahanap kami masigasig at malikhaing tagalikha nilalaman mula komunidad Filipino gustong tumulong sa amin. Isulong pagkakaiba-iba, kultura at koneksyon komunidad buong Cayman Islands. Kung pinangarap mong mag-host sarili mong palabas, magbahagi nakaka-inspire kwento o magpakita pagmamalaki Pilipino, ito na ang iyong sandali. Naghahanap ang CMR TV ng mga malikhain at independenteng tagalikha ng nilalaman na handang magsama-sama at gumawa ng lingguhang palabas na ipinagdiriwang ang karanasang Pilipino sa Cayman at higit pa. Kaya't kung mayroon kang talento, mga ideya at lakas, gusto naming marinig mula sa iyo. Sumali sa pamilya ng CMR habang patuloy tayong lumalago, kumonekta at kumakatawan sa bawat sulok ng ating masiglang komunidad.
All right. There you go, honey child. So apparently someone was insulted that, I didn't do a request like this. They didn't say anything like this for the Caymanians. And I said, you do have to be kidding me, right? First of all, it's shocking that you guys don't really pay attention. You're really not paying attention, because we have had a number of the content creators here on the program, including a good number of the Caymanian content creators. And I've told you on more than one occasion all of the amazing stuff that, we have going on. So I can't force anybody to do anything. I have a list of independent content creators that are coming together to demonstrate their skill set. And we are setting up a what hopefully will be a robust platform for them to be able to have unique and amazing shows. But if Caymanians don't want to be involved, or they don't want to be the forefront of this, what y'all expect me to do? Beat them over the head with some of them old time whompers? That not gonna happen. I am literally, just because I don't post a video saying to them, I am literally on my hands and knees begging certain Caymanians for even the government getting involved in the youth show, the culture show. I mean, there's so many things. So listen, we have an amazing lineup of individuals. If you're Caymanian or not, and you want to be part of this, simply reach out to me. There is space and scope for everyone. Would I be amazed and tickled pink to have all Caymanian, entire Caymanian complement of content creators? Of course I would be. But we have a very diverse community. And so CMR TV is all about inclusion. And our Filipino community, they're actually super fans of this platform, in case you guys didn't know that. And they are more than welcome to have their own community-based show. Unfortunately, the ones that we had on, they're having some commitment issues, so they're not going to be able to do it. So the reason why this, shout out and call for some new content creators went out was because that particular group needs sort of a replacement group or individual who can spearhead, a show. So let me remind you of the lineup. There's myself, obviously, holding down the fort in the mornings from 7:30 to 9:30. Daily show. We have another daily show with Sabrina Speaks in the evenings with Sabrina Turner, civic educator and public accountability advocate. She's on during your drive time in the evenings from 5 until 7. Wendy Ledger and I are partnering up for Court Matters. We have Tamsin DC, who's going to be doing the AI Wave, an AI-based show. And she's got some amazing interviews and interviewees lined up for that. We have Miss Julie Hunter, Caymanian from West Bay. Hello, y'all know Miss Julie, MP Julie Hunter, parliamentary secretary. She's going to be doing a show called Kitchen Table Talks. And this is flipping the switch a little bit on Miss Julie, because the funny thing is she is used to being the person being interviewed. So now she is going to be doing the interviewing. I'm so excited to see her in this role, because I can tell you that when Ms. Julie first started the whole politics thing, she was a little bit shy about being in front of the camera, because, that's just not her. She's not looking for attention. But check her out now. Look at this shot I got yesterday where she's interviewing one of her own Caymanians, Ms. Jazz Pitcairn. And, she's doing it in the kitchen over a little bite to eat, and she's cooking, and she's going to be doing all sorts of fun things. So I'm really excited to see her shows. And again, that's Kitchen Table Talks with MP Julie Hunter. Then we have Mind Matters with Dr. Sarah Nichols. You're going to meet her tomorrow. So make sure y'all are on time tomorrow, because she's coming on at 8 o'clock. And Dr. Sarah is a clinical licensed psychologist. You guys remember that we had Dr. Carlos, but Dr. Carlos actually sold his practice. So, Dr. Carlos is kind of getting out of the business, so to speak. And here we are. I'm gonna actually mention in my content creators group that I'm bigging them all up right now if they want to tune in. We've got people from all walks of life. I mean, this is such an amazing lineup that I refuse to let any of you naysayers steal the thunder that is going to be CMR TV talking about, oh, you're not going to have enough Caymanians. Try and go hush and sit down. I mean, honestly, have you guys ever tried to create anything where you have all Caymanians involved? If you did, you would know how impossible that is, honey chill. I'm just saying. We invite all the people that call on this show all the time. Denny Warren Jr., Johan, Baliki, who else? That I've invited. Come and have your own show. And they've said no. Mr. Billy, he's in the Caymanian, but the others at Caymanian, even Kenneth Bryan. Kenneth, come and have your own show. Nope, too busy. So what y'all want me to do? Exactly. I'm just saying. All right. So Dr. Sarah, I love Dr. Sarah. I think you guys are going to really enjoy her vibe. She's taken over Dr. Carlos' practice. So she will be here. And the thing you're going to love about her is she's a Caribbean woman. I'm not going to tell y'all yet about her background because we're going to cover that on tomorrow's show, but she's beautiful. When you're talking about Caymanians, have a look. To be honest, she looks like she could be a Caymanian. The Cayman Classroom, that's one that was supposed to be done by UCCI, but I don't know if that's going to happen yet. We're still waiting to see. Anyway, that's all I'm going to say. Getting to the Top, Uncommon Advice. This is hosted by Raquel Moses. Raquel, again, is a Caribbean woman who is a CEO and global ambassador. And you guys are going to love her focus on entrepreneurs and interviewing them and understanding what their formula is for success. As you see, we have a lot of amazing women lined up, and I love that. We have Books and Bush Tea by Aniki Brown, of course, Caymanian author and book lover, and she is going to be telling us all things, in terms of the literary arts, and I'm looking forward to her. I know she's been very, very busy doing recordings. We have Authentic by Rayon Francis. Another Caymanian coming in, Chef Alfonso Brown, culinary coach, and his show, Throwing It Down with Chef Brown. So this show, Pep Talk with SSS, unfortunately, that was our Filipino show that they're no longer going to be able to commit to getting us their episodes. So we're looking for, if you're a member of the Filipino community, we are looking for, someone else to pick up the mantle from them. So reach out if you're interested, and let's have a chat and see if we can, sort of forward that. We have GCS Animation by Golden Pirate. That's his character name, and that's an animation show that's going to be shown on Saturday that's safe for kids to watch. We have Driven by Auto Shield. That's Jonathan Webster, another amazing Caymanian in his profession. Jonathan owns his own company, Auto Shield, and they do amazing work. Jonathan is just such an amazing young man. So he will have his own show. We have The Real. We're hoping this is going to be our new youth program, because remember, right now we have 0 youth programming in the Cayman Islands. So we are hopeful that we can get some sort of a commitment from government to assist with the sponsorship of that show. And that show is going to be a show for young people by young people. We're not going to be adults sitting there talking to them, telling them what to do. No. They are going to be the host of The Real. So, yeah. And if you're able to sponsor a show, let me say this now. All independent content creators are looking for show sponsorships and advertisers. So if you are, interested in being a content creator, or you're interested in, sponsoring one of these content creators or advertising, because their shows are going to blow up. I mean, I don't have to tell you all that already, but if you're interested in being part of their success and also promoting your own companies, et cetera, this is a time now to get in and to inquire about those types of things. Just saying. All right. So Cayman Voices, which is a series that is sponsored by the DART organization. So let me do a big shout out this morning to the Kenneth B. Dart Foundation. They sponsor a number of things in the community, and they've been doing Cayman Voices now for years. And this, as you've seen our episodes, now I haven't been sharing too many episodes with you lately because I'm banking them, so I'm recording them. And then I'm kind of banking them for when we launch CMR TV, so that we have new episodes that you've never seen before. So I'm busy recording. So I thank them for their continued support and sponsorship. So I am busy continuing to record, but now I'm getting them all recorded and lined up to add. So we'll be able to add some of the archival shows as well as new shows. For example, we have Miss Virginia Bodden that we've done. We've got a couple Cayman Brackers that we've done as well. And in fact, I'm thinking about doing a trip this week to the Sister Islands, to Cayman Brack in particular, to conduct another few interviews there of Caymanians. So I might be live streaming from the Brack. I'll let y'all know how that goes. But yes, I may actually be doing that this week. All right. So Cayman Voices, a great show. I love that show. I absolutely love me some Cayman Voices. I learned so much myself. I tell you, that's like a classroom in a recording. Then we have Echoes of Cayman with Caymanian radio extraordinaire Chuck Taylor. He's been in radio for over 20 years. He's going to be hosting a show celebrating the sounds of and echoes of Cayman. So all local artists, this is where we're going to be featuring you. Please reach out if you have any local music, local content, because we're building an archive of music. And during this hour each week, he'll be conducting interviews with local artists as well as playing their music. It has to be radio friendly because CMR TV will eventually, the last stage of it will be CMR radio. And pretty much everything that's on CMR TV, probably 99.9%, is going to be over on CMR radio. So I want to ensure that the content is clean for radio. So, none of you young people got your little songs with your curse words and whatever. We can't really accommodate those. So then we have Dr. Mark Gadari, Elevate Cayman. He's going to be doing everything business related. And he's not Caymanian, but he's, again, our Caribbean cousin from Jamaica and lived in the States all of his life, pretty much from the age of 9. But Dr. Gadari actually teaches online business courses at ICCI. And he is going to be telling people the ins and outs of, startups and businesses and entrepreneurship and leadership and all that great stuff. So that's his show. Of course, my alter ego, Aunt Lottie, we have a show by her, which is me in character. The Gospel According to Aunt Lottie. I got to get a picture up there. I got to put on my wig and do a picture. So we'll do that. We've got Territories Talk with MP Thomas Famous. He, again, is an incredible, does incredible shows. So we're going to be having his lineup. We have another Caymanian, Jessica Moore, Salt and Coconut, Caymanian Food Stories. I'm so excited about this. Jessica is the owner of Fresca. Now, listen, let me do a shameless plug for Fresca, because if you've not been to Fresca, which is a restaurant here in Country Corner, in Savannah, you don't know what you're missing, honey child. They have an amazing menu. They kind of do Asian fusion meets Caymanian style. So she's got these like sushi recipes that are inspired by all things Caymanian. So everything from the Enda, like Enda, East Enda, North Side roll, North Sida, or whatever it's called. She's got a whole tuna. The tuna roll is like one of my favorite. But she's got an amazing menu. Like the food legit is just off the chain good. That's all I can tell you. It is really, really good. And on top of that, young Jessica also is one of her content creators. So she's going to be in the kitchen throwing stuff down and showing us different things. And, sometimes I go by Fresca and I see her in there actually in the kitchen working in her own business. And I love it. She's got an amazing cheesecake not cheesecake, they might have a cheesecake too, but the carrot cake. Ooh, honey child. I don't know who gave her that carrot cake recipe, but that's good. But I'm on a diet right now, so I can't have any. Okay. But yeah, Jessica is amazing. I love her vibe, her food at the restaurant. The staff is super friendly. Please go support Jessica. Check it out. They're closed on Mondays. They do an amazing beef on, I think Thursdays is beef. Cayman style beef, or Wednesdays. Oh Lord, I need to look at the menu. But they do an amazing Cayman style beef during the week. They do turtle. The turtle always be sold out by the time I'm ready for dinner. Oh, missed it last week again. They do curry chicken. I've had the curry chicken. It's good. They've got an amazing hummus. Like literally everything I eat there, I'm just like, oh, this is delicious. Check out Fresca. All right, we've got Miss Tanisha Barnes. Well, we're trying to get the Ministry of Youth Culture and them. We're trying to get them to do this Cayman Culture show called Cayman Culture, but we're still waiting on confirmation. As a matter of fact, I can message the minister right now and say, yeah. All right. We got to chase them up on a few things. Okay. So we got 4011, which is the Ministry of Youth Sports Culture and Heritage. And they're doing what's really called a Ministry Matters show, but they've customized their name. So that's them. All things related to their ministry. Weekly show. We've got Polished Presence, which is another Caymanian, Melanie Sims, and she will be doing her etiquette show. And then we have Miss Carla Yi Singh, Fit and Fierce with Carla. Caymanian by now for sure, because she's been here for donkey years. We have Caymanian Elizabeth Evans, half Cayman Bracker, doing the Art Beat, which is an art show, really going to be wonderful for your young kids. And then we have GTR, which is Genesis, Timeline, and Roots by another Caymanian, Dr. Wilton McDonald. So listen, the majority of people here are Caymanians, not for nothing, but come on now. And we have, dun, 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 Finding Our Freedom. Miss Marla Ducaran, Caribbean economist and advisor, is going to be on CMR TV. Big that up. I'm excited to have her. I love her. She's amazing. All of my content creators actually are amazing, because y'all don't know why y'all sit down and criticize about, oh, get all Caymanians. You all have no idea what it takes to even pull something like this together. And I'm not done. There is more to come. We want as much original, locally produced content as possible. So, I'm in talks with some NPOs. The Football Association, they're going to be doing a show. I need to add them to this. Who else do we have a commitment from? I mean, people are coming on board because they see the idea and they see that this is going to be a winner's circle of content creators. So yes, super, 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 super excited about this. And if you have the bug, and most importantly, you have the structure where every week Auntie's going to need a new episode from you, a new show, and you're able to do it, by all means, step up to the plate. It's not easy. And that's why some people have said no, because they've got other stuff going on in their lives. They just can't commit to it. They're working a lot. They're, whatever's going on, they just don't have the time, because it does take time and resources to pull this off and to get it done. I would love to have another midday live show. So I'm looking at some options, perhaps regionally, for that. So if you know of anyone in the region who might be interested, reach out to us. I'm out here hustling, trying to get people to come on board, because the more variety we have, the better. So yes, we did do a call out for anyone in the Filipino community to come forward if you want to pick up the mantle, as I say, from SSS, who are not going to be able to commit to it again. They're just having some commitment issues. They're just busy. They're working. Obviously, they're on permits. They're working for companies that keep them very, very busy. So let me know. Ms. Lucia says, don't worry, I'm coming to have my own show soon. Well, you know what they say, Miss Lucille? A promise is a comfort to a fool. We've had people who had good ideas and even time, like, oh, I want to do this in the first episode, and they just can't pull it together. Because despite what people think, being a content creator is not as easy as you believe. Mm-hmm. So I'm looking for a sports show. Let me tell you what else is on my dream list. That's why I was messing with Shamari this morning. So definitely sports. Like I said, SIFA's coming on board. So we got all things SIFA covered, Football Association. But we need like a general sports show. All sports, swimming, cricket, whatever you guys are into sports-wise. We would love to have a general sports show. Nathina says the Cayman Islands Dart Association, their league starts tonight at Manga Tree and Fidel Murphy starting at 7:30 p.m. So they're at 2 locations. And she's inviting everyone to come out. You see, now if we had a sports show, this is the kind of amazing thing that they could be covering, like going to the Dart event and doing a few interviews and, and listen, in this day and age, somebody said, what about a sports show on running my mouth? Does that count as a sport? That would be Cayman's number 1 sport, honey child. Chatting. We're the world champions of that. The day they make that an Olympic sport, Cayman bringing home a gold medal. That's all I can tell you. But yeah, I wish we had, a sports show, and I can't do it all. I have to recognize that as much as I would be like, oh, I can host this show and I can do this interview. No, I really can't. So, it just, I need to know my limitations. Chances are I'm going to be the one doing both youth programs, because I want one for teens and then one for the younger kids, which is going to be like a fun kind of like reading style show, and they can come on and do reading and that sort of thing. So I'm still working on that one a little bit, but can't do it all. There's only 24 hours in my day as well, and I'm pretty busy as it is. So if you have an idea, you want to talk, by all means, let me know. All right. So on my list of things that I'm working on is I need to find someone to do a sports show. I want to do the 2 kids show, and then I'm doing Aunt Lottie's. So like my sort of content creator calendar is pretty full. So that's why I know I can't take on too much. Mm-hmm. But anyway, so I want to congratulate all of the content creators who have stepped up to the plate thus far and have been working diligently behind the scenes so that they are really ready to go here shortly. And yeah, good stuff. All right, honey chill. Trying to moisturize my lips. Sorry. They're feeling a little bit dry this morning. Mm-hmm. All right, let me see what else we got here. Thank you. Miss Lucy says, no, you don't want me to have my show. You have, what? You have too much fun worn out, you and Sabrina. Big shout out to Sabrina, not for nothing, but she has really been doing a phenomenal job, because it's one thing to do a show where you can pre-record it and you can edit it and you can have a script and you can have your teleprompter and all that great stuff. But to do a live show, 2 hours every day, let me tell y'all something. That is not as easy as you think. I should know. So I take my hats off to her. She said it's all my fault. I kicked her in to the deep end, what them Caymanians used to do. Your father used to take you out on the boat and just drop you off and said, I'll come back later. You better learn how to swim. And it was like, oh my God, if I don't learn how to swim, I'm going to drown. Yeah, that's kind of what I did to Sabrina a little bit. Not quite as harsh, because I did spend a week with her, because there's lots of moving parts to our live show, taking callers and the board and all kind of stuff. But, I made sure she had no excuses, honey child. I got my backup board. I was like, here you go, Sabrina. This is brand new. Never gets used. Here's your cables. Here's the mic. We're going to order you a camera. And then the last time I went into her studio about a week and a half ago, my mother-in-law was still here. Honey child, I was shocked. Sabrina got an arm with her 3 monitors set up. She got other lights set up. I was like, what is going on here? This has really turned into a professional show. And I was like, mess with you. It looks amazing. Like behind the scenes, you don't see all the stuff that she has. And I have someone who's been raving about how beautiful Sabrina is. he said he did not realize that she is so beautiful. I was like, be careful now. She's a married woman. So don't tell me she's beautiful more than once, because then I have to tell Mr. Eric and you. But yes, she is gorgeous. And what can I tell you except, she's doing an amazing job and looking good and got all her stuff lined up to make sure, the lighting looks pretty good. I mean, I'm just in awe of what she has been able to do. It takes a lot of hard work to do this every single day. And what is so amazing about what Sabrina has done is that, quite frankly, others, I'm not calling any names because they're no longer on air, have tried to do that evening drive, and they have been unsuccessful in doing it. She really came on the scene and blew them out of the water. And did it in style. Oh, look at her yesterday with her little poppy seed. Oh my God, I haven't watched. Oh, Sabrina, you did not. Let me show y'all something. I just pulled up her show from yesterday. Look at this woman's studio. This looks so good. She's outshining me, folks. Let me show y'all what Sabrina's got going. Look at her background. We're in the season of fall, and look at this. She's got her little pumpkins. She's got her plant, all her fall colors, her throw, her pillow. Oh my gosh, look at her studio and her little poppy seeds, because she went to the veterans fundraiser dinner on Saturday evening. Sabrina, I'm proud of you. Good morning, caller. Hello?
I'm proud of you, Sandra.
Aww.
I just called in to say that when you're talking about certain shows, listen, see the CMR mission, always imitated but never duplicated. Keep up the good work.
Thank you so much. I appreciate that. You're amazing. Oh, thank you. Little heart emoji. Oh, but Sabrina looks so good. Ooh, I love that pearl necklace. I mean, yep, she's always on point. Makeup is on point. Hair is on point. Always looking good. And I love what she's doing with the studio. I love the change up. And so let me tell y'all something, okay? I gotta share a little success story with you guys. So we have acquired some space where we are going to be able to fit out. And I'm going to put Sabrina in charge of decor, because clearly she's got a knack for this sort of thing. Where we have been able to, good morning, caller.
Morning. What you doing, boss?
I'm good. You're on the radio. What's going on?
I am proud of you, man. I'm telling you, you are a fantastic lady. You are doing a good job. Remember, I tell you.
Oh, thank you so much. I appreciate that.
I'm proud of you, man. I have to
Thank
call
you.
and let you know that, keep up the good work, and you are doing a good job. Don't worry about it.
Thank you. I really appreciate that.
All right.
All right.
Have a
Oh,
good
you
day.
guys are making me soft this morning with your compliments. Oh, thank you so much. But yes, I mean, we are definitely gonna put Sabrina in charge of the decor of the studios, but I'll tell you what in just a second. Good morning, caller.
Good morning.
Good morning, darling.
Good morning. I said you don't want me to come and do my show because you and Sabrina both have me worn out.
Oh,
That's what I said.
oh, worn out because you're up listening early in the morning and late at night.
I can't keep up with her at night.
Oh my gosh. Yes.
You all take care now.
Thank you, my
Love
dear.
you always.
Thank you.
Bye-bye.
Appreciate it. Bye-bye.
Bye.
Yeah, she's on UK time. So for her to catch Sabrina's show, that's kind of late into the night for her. So don't stay up late, child. We want you to get your rest. Miss Lucille's up in age now, So, let me see here now. Hold on one second. So I'm going to show you guys Okay, so we've acquired a space where we're actually going to be building out studio spaces. So listen, if your excuse, because y'all be looking for excuses now, if your excuses have been that, oh, you don't have a space to record, soon that will not be an excuse. We're going to have space available for our content creators where they can come in and they can one second here. They can record their content, and it's a space that's like set up. It's going to be like, set up like a studio space, and you can sit there and record. And so I love this idea that Sabrina is using, which
Marriott
is, she's adding her little seasonal touches and stuff like that around events.
Sponsor of
so I think I need to put her in charge of decorating some of the studios around the seasons and stuff. I absolutely love this idea. So big shout out to you, Sabrina.
We had
you are really
and they
doing
give special
amazing,
rates. And what I learned
things.
last night,
And
yesterday
so
at
this
brunch,
is part of our expansion. Is we're going to actually
was that
have
there were
several
some people who
studios
took advantage
available
of the special
for
rates
people
that
to
once
go
you were attending
into
the
and
Veterans
record.
Gala.
So if you've always wanted to host your show and you just haven't been able to pull it together, trust me, there are ways that you can do it. Now listen, I don't micromanage adults,
it was amazing.
So it's not
Did
about
you know that they had, like,
but I will
babysitting
still
services?
give you the tools
They
that you
actually do.
need to
They
be
have
able to pull
babysitting
this
services
together
once you're
in
a
the
guest
sense that I'll give you advice
their
on
resort.
what you need to
So,
purchase,
from what
what
I
you need to
understood
buy.
at the
In
brunch
this day
table
and age,
yesterday,
folks,
'cause they were all
we
at-
can
at-
do
at a
so
they were different
much
tables,
with
but
so little.
they were there,
I
and
tell
it was
you,
exciting because
it is just
to know
amazing.
that
I want to
they
show
offered
you
that
guys
service
an
there at
interview
the
because this was
But
Sabrina's
yet,
show
look
yesterday.
at that.
See?
Look
She
at
had
where it took him. I don't have
Shaden
official
on.
pictures of him of the event,
Shaden,
but
you're
we got
looking
some
so
showing you that
good.
life
Oh my
continues
goodness,
even
you look
after.
really nice.
Because it is all about a
wow.
balance. But I do have
From
some
the Cayman
candid
Islands
pictures of us,
Veterans
yes.
Association, she puts on this annual
Well,
dinner
so
every
that is
single
our
year.
that's our president
Because
of the
they are
Mets, Dr.
supporting
Sidney
veterans,
Ebanks.
and they do a fantastic job.
And he's
What's
such a
Dr.
trooper.
Sidney
He's
doing up in that picture? What is this? Look at you guys.
not
Look
one
at
of
Dr.
those big
Sidney. Where was
socialites and
this?
stuff
No,
like
Did he
that.
go to the
but
veterans event? Well, he was in the military or something, right?
This
Dr.
is
Sidney's
Susan
bad at.
Oldham-Hampson.
Oh, it's still 9:17.
A lot of people may
I'll
know
tell you
her
after. I'll tell you at
the
9:30.
power of the community.
Don't let him fool you.
They
You
wanted
look
to
at
know
him
why
and,
they were
and think that
responsible for paying the
mhm.
fine.
Can
So
you imagine?
the bankers
check out
tried
the
to turn
veterans.
into
Oh, there's some
lawyers
pictures from
and
the event.
deliberate, but it
Sabrina,
didn't work.
you
They
need to
ended
send
up
us some
having
pictures
to
so we
pay
can do a story on it.
$5
Because Shaden didn't
per
invite me this
young
year.
lady at the
Mhm.
table seated
And
with
she
them for the
didn't
fine.
send me
So
anything
these are the
in
fun
relation
things that
to
go
it
on
either.
throughout the night. And how
I
we
love to
raise
support
additional
events like this. The veterans
This was
need all the
another one,
support
but
that
this
they can
was
possibly
this
get.
one was
And they play a lot of
the
fun games.
Coast
It's
Guard,
really
the
fun. I've been
entire
before,
Coast Guard.
and it's amazing.
everything
fun
that the
time.
cadets do.
But
So that is
this
another.
looks great. So I'm sure she was talking about all the amazing things that the Veteran Association does,
Like
and
and
how
as
they
you're aware from
support
Fort
veterans. Not for
Foster,
nothing, Shaden, but that hair is
he
looking
thought
good,
that
honey.
they were just really bad.
So
Is stronger
beautiful.
than my fear. And for
Oh,
anyone
she's showing
out
off her
there
tattoo
fighting
as
the
well?
fight,
I didn't
keep
get to
your
listen to the
faith
show,
and make
but
sure that your
what?
faith.
Looks like I need to go back. Very
And
nice.
I will
And
tell you
so
that
let me tell you the other
100% of
thing. Just hold on a second here. Let me go to CMR's site, the Facebook page. And of course, it's Breast Cancer Awareness Month. So I'm doing a lot of behind the scenes interviews for that. Good morning, caller.
Good morning, ma'am. Two of you talking at the same time.
Oh, sorry. You can hear. Oh, I thought I had that muted.
No.
Oh, my goodness. I'm sorry. Okay.
Wonderful job. Thank you.
Thank you so much. Oh, yeah. Maybe I didn't. Did I not mute? It says muted. Strange. Okay. Thank you, Marcia. Two audios playing at the same time. It should be muted, but I also double muted it in the studio now. Thanks for pointing that out. Yeah, it says muted in Facebook, which is kind of weird. But let me, hold on. Let's go back a little bit here. Let me show you something here now. So I'm going to show you Sabrina's, they say the proof is in the pudding, right? And so a lot of people were like, oh, Miss Andy, I don't know. I don't know if Sabrina, I can just do a screenshot here. I don't know if Sabrina's going to be able to handle doing a live show. Y'all try and hush. You of little faith, try and sit down and let me show you what amazing job Sabrina has been doing. Look at these views. Her show yesterday has over 6,000 views already. 3 days ago, which would have been Friday's show, Wind Down Friday, 8,000 plus views. This is real. This is Facebook, honey child, that shows you these analytics. The day before that, 7.7 thousand. The day before that, 7.7 thousand. 9.2 thousand a week ago when she talked about justice or just expense at home. Oh, that must have been a good show. 9.2 thousand. When Truth Hits Home. Oh, what was that one about? 9.5 thousand. Her previous week's rundown, Wind Down Friday was 10.6 thousand. Courage, Care, and Community, 12.8 thousand views. Oh my God. Let It Out, K-Man. 15.7K. Listen, these are winning numbers. 14.3K. Honey child, if you're sitting here thinking, I need to advertise in a show where 8,000 people, 6,000, 15,000 people are going to see my commercials, y'all better reach out to Sabrina. On a serious note, support the content creators. Now, here's the model, because you're sitting there thinking, and I know some of you, your little brains are working like, oh, I could do a show. How does this work? I tell my content creators, treat this like a mini business model. You go out there. I would love, you know what I would love is a home decor and decorating show. Oh my God, who does not love HGTV? But this would be like K-Manion style, right? Go out there, get sponsors for your show. Whatever you get for your show is yours. Mama Sandy got her own coins, and I'm not taking anything from my content creators. I want to encourage my content creators to go out there and make a living off of their shows by getting show sponsorships. Absolutely do that. And you know, Sabrina has set up her own company called Bridge Media. She is doing phenomenal. And so, yes, we have space now. We're going to be fitting out the content creator rooms, and we have a space for our radio station. And I'm really excited. I haven't talked much about the radio station because it's going to be like the final phase of everything. But once we get there, I'm really going to be excited to be like on live radio, because I know when you're stuck in traffic and you don't have data, you guys want to be able to listen to radio. So I've had a phenomenal run here on Bobo, and I thank the DMS organization, Don Seymour. Thank you very, very much. And now Stingray Media. I thank them for this amazing opportunity, because we're like years in and still going strong. But, you know, I'm a business owner, and I believe in what's the word I'm looking for? I believe in autonomy. Is that the right word I'm looking for? Might be. I'll tell you in a second. Where, you know, I can make my own decisions and kind of do my own thing. And I know sometimes things get a little hot in here and y'all want to be complaining, like, oh, I'm going to go call Don Seymour. Well, once I get my own radio station, you'll be calling me to complain about me. And then you know what that's going to be like. Because I'm going to be like, Erks, honey child, talk to the hand, because nobody else is listening. That's what I'm going to tell you. But anyway, yes, this is going to be an exciting transition phase for us. Taking a little bit longer than I wanted to, but all things come to those who put in the work, yes, and have a vision, and we're getting there. Melita says, San, one at a time, please, and thanks. I'm sorry, that's muted. That's so weird that you guys were able to hear it. And the weirdest thing is I couldn't hear it, which is like, if anything, I should have been hearing it as well. Very strange. I'll look into that, because that should not have happened. So we got to make sure these fancy things here are working as they should. Thank you, Marcia. Appreciate you, darling. Shaka Zulu says, thanks for the CMR TV update. Yes, because I think you were asking me recently what's going on. So it's coming. There's a lot of things in the back end. I'm working. I got the whip out right now with my back end website guys saying, hey, hurry up, get things done. But I can tell you that we have an amazing design team that has really, really done a phenomenal job on the website as well. So I think by next week, we're going to start just rolling things out. Mm-hmm. All right. Okay. Still play. Okay. Mm-hmm. Yes. So thank you. I didn't hear the audio. That's so weird. Okay. That tab was muted. That is the weirdest thing. You see, when I have an issue like this, I'm like, this is a quandary now because that tab was definitely muted. So how is it possible you were hearing it? I don't even know. But I'm going to message the technical team and see what was going on. All right. Let me see here now. Honey chill. Evelyn is really enjoying Sabrina's show. She says, community activist. She's awesome. Love her segments. Thank you so much. Ms. Darlene, good morning to you, honey chow. How you doing? So let me show y'all something. So yesterday I did an interview with the Cayman Islands Breast Cancer Foundation. I'm going to pull that together today and have that ready to air. What an amazing organization. They do a phenomenal job. Let me just tell you. Seriously. I love how many MPOs we have here in Cayman and all the amazing work that they do. And so I wanted to share something with you guys because you know me, always trying to stay in the forefront of modern technology. Got some new recording equipment. Hold on a second now. Let me just remove this one from the studio. Look at this, folks. So when I do my solo recordings now, because you know I'm a jack of all trades when it comes to the content creator space, I'm able to, where's my content creator friends? I am able to do picture in picture within my recording now on my mobile device. Isn't this like super cool? So hold on a second. Let me see here now. I want to page. Okay, let me take that off. Oh, let me see if that's what I'm looking for. No, hold on. I'm looking for a little setting here. But yes, this now is where I can actually, this is so cool. I can actually be, like you can see me in doing the interview. So this is Ms. Bev and her team over at the Breast Cancer Foundation. And so you guys are going to get to hear this interview. Had a really lovely time with these ladies yesterday, but I am loving this picture-in-picture feature. Like this is next level fun for me because a lot of times I'm out doing a live stream. Oh, you know what? I wonder if it works with live stream as well. I haven't even tested it yet for live stream. I don't know. That's a question. Anyway, got some new gear. And so it allows me to do the whole picture-in-picture thing. So you see me at the top there, and then in the main screen, you can see, you know, the rest of it. This is so cool. I'm so tickled pink. I am just excited about the technology that we have available. I've got some new mics that I have had now for a hot minute that I need to start playing around with and getting used to using. I've got my 4 mics set up now that I can do right from my mobile phone. Oh my God, I can't wait. Can I please interview a group of 4 people? Well, 3 plus myself, because then I can use my 4 mic setup and I want to test that out soon. So lots of exciting things going on. You guys know I love the technology and I am here for it. And it's just phenomenal. Can't wait. So we're on a roll and we not stopping. So here we go. Let's do a big shout out Oh my gosh, what is this? Let's do a big shout out to Jevy Ebanks over at Radio Cayman. Today is Jevy's birthday. So happy birthday at Jevy. Hope that you are having a fantastic one. Okay, let me see. I got some messages coming in, and then I want to show you guys something that just came up in my Facebook feed. Let's see here. Reminder, we're waiting to hear about the Seaman's Quandry. Oh, Lord have mercy. Not going to be today. I'm going to go to a 10 o'clock appointment, so we're going to talk about that another day. Yes, somebody said be minded. They're not daily shows for you and Sabrina. They're weekday shows. That's right. They feel like daily. They are indeed weekday shows, Monday to Friday. This person says, good morning, TD. It's a success because of honesty and ambition. You care and give back more than what the churches and government is doing for people. Sandy, you're a great business owner and give great customer service. Thank you. Oh, my goodness. Thank you so much. Little heart emoji for you. Oh, it's also Jay Ebanks' birthday today. What? Happy birthday to Minister. Jay Ebanks, yes, sir. Come on through with the birthday greetings. I'm going to post some of these up. So Minister Jay, we're going to give you a birthday shout out. I'm just going to send these to my graphic designer so he can do some birthdays for me today. Where's Jevy? Let me grab a little picture of Jevy. Jevy. Yep, today is his birthday. Who else is celebrating a birthday today? Big shout out, Jevy. Appreciate you. I'm going to tell y'all something that Jevy has done recently. We'll tell you once we get through with it. Thank you so much. You're doing more of God's work than most people, than some of those so-called mean, lying, so-called church people. All you left to do is be baptized because you're doing the work. Aw. Yes, thank you. All right, we've got a missing dog. What's this? Good day. Trust that you're well. May you please request you can post this dog found near Tim Hortons this morning about 5:45 a.m. So are you missing a dog? Kind of a brown looking dog. So we'll post this cute little thing. Oh my goodness. Somebody's missing him, I'm sure. Him or her. Let me have a look at my messages because sometimes what I find is somebody else is messaging in the messaging center where, yes, they're actually looking for their dog and we just haven't seen the message yet. So let me just have a quick little look-see. Hi, Instagram. Let me see here now. Go into messaging. The best way to reach me, folks, is WhatsApp. Because we don't have anyone checking the messages now except for me and Shal. I'm busy. So live stream today, official promotion, Cayman time for young Caymanian Peter Edwards. Okay, LBA Academy versus, this is basketball. So Peter Edwards, Caymanian, is, oh gosh, how do I reshare this? All right, so he is playing today at 10, after 10 o'clock, I think he said. Good morning, could you please share this wonderful day coming up on October 25th to support the Breast Cancer Foundation? So they're having a pedal in pink, Pilates in pink, pose in pink class. Yes, sure, we support all NPOs. Yes, okay. So missing, we have a dog, found this dog near, okay, so several messages that the dog has been found. Okay, but I don't see anybody looking for the dog yet. Power is out and Spots Newlands at 143. Mark, hopefully you got that back. Okay. Let me see. Hi, saw your post about modems. They may be for flow. Oh, thanks. Okay. Okay. All right. Uh-huh. Card holder, what you sound. Okay. All right. Nobody's looking for this dog yet, so we will post him up, and hopefully his owners. How can you not know if a little dog like this got out? I don't know, but we'll post that up, and hopefully you can. If you're missing your dog, you can come and collect him because some people have found him. I'm always surprised how some of these little dogs, they're like little Houdinis. So I'm not saying they can't get out because trust me, I know them. I got one. They be running from to and fro, honey child. But let me see here now. Let me just edit this. So yes, if you're missing a dog, probably from the Prospect area, please reach out because it looks like your dog may have been found by some good Samaritans. Cute little thing. He looked like he was having the time of his life, probably rolling in the mud or something. All right. So we will post him, including on the CMR community page. Don't forget to check out the community page where we post all lost and found things. So that is now posted. If that's your dog, reach out. We will we'll put you in contact with the people who found him. All right. So funny enough, with anesthesiology, World Anesthesiology Day coming up, look at what I just found on my timeline. That is quite, what's the word? Not appropriate. Oh Lord, what's the word? Hold on, let me see. Oh gosh, that's not the word. There's a short version of it. Oh man, help me remember what that word is. It's like on the tip of my tongue. But anyway, look at this image. Isn't this interesting? This woman here, she suffered over 30 surgeries without anesthesia. Apropos. She suffered over 30 surgeries without anesthesia, and he became the father of gynecology, and she has been forgotten. Her name was Arnarcha Westcott. Can you imagine? 30 surgeries without anesthesia. Oh my God. Whoa. That is crazy. Can we give a big shout out to the anesthesiologists? Because wow. Yeah. That's next level. Here's a little doggy. Thank you, Miss Rose, for asking. That's what he looks like. Brown and shaggy, and looks like he's living his best life. He's so cute. So if you're missing your dog, please, by all means, reach out if that's him, because somebody found him. I always like a good reunion story when it comes to dogs, honey child, because some of them don't make it back home. Poor little things. Ugh. Yeah. Strong Will says, why don't you book your appointment later in the afternoon instead of being rushed early in the morning when the show is getting hot? No. Sometimes I can't because I've got a 12:30 appointment today for restaurant week. I got to go check out a restaurant. And so I need to do stuff before then. So I'm sorry, Bobo. That's not going to happen. Not today. Yes, I'm going to get in my car here shortly. CJ Cooper says, word. He must be made out of iron. She must be made out of iron. Oh my God. They tortured us, you know. As this person says, Black women were used to test all medical procedures because they didn't think that they felt pain. Black women should be applauded for all advancements in obstetrics, as well as everything else. And not just Black women, But men too, they were testing all kind of foolishness on us that you would be surprised at. Trust and believe. Remember the one from Rob, 8 foot. That's too big, I think. But what was I going to tell you? Yes. Listen here, honey child. It's pretty crazy how people were experimented on. They were infecting them with diseases and viruses on purpose. And, you know, for so long, they did not see Black people as humans. So they were like, oh, yeah, they're up for it. We can treat them like whatever. Unbelievable. Oh, my gosh. Oh, 30 surgeries. That is so crazy. All right, I got to go because I want to be punctual to this appointment. I need to get my hair done. It's kind of looking a bit messy. So that's where I'm going today, honey jail. It looks like a hot mess. I need to get a little treatment. See my comb here? These old-fashioned combs that we used to have that we still see. It needs to be blowed out, honey child. I told you guys I don't chemically, what do you call it again? What's that stuff called? I don't straighten my hair anymore. I don't relax my hair. If you know what relaxing means, that means that you're a person of color. So I don't do that anymore. So I do feel like my hair is healthier, but you know, sometimes I got to go in for a little detangling and a little treatment and stuff and a little blow dry, honey child. So I am going to do that today. Remember these little, y'all still use these combs, right? Am I the only one? Nope. Good. Yeah. So I'm going to go in for a treatment today. And that's where I got to go because I want to look good for my little lunch so I can take a picture for restaurant month. Listen, as a content creator, sometimes I got to be dressing up and stuff. My hair falls out a lot. If you ever see my guest bathroom when I'm combing my hair, you're like, Sandy, you're losing your hair. I lose a lot, but I retain a lot. You know what I'm saying? That's just how it is. And it's kind of always been that way, actually. I just shed a lot. I'm not a hairy person anywhere else, but on top of my head. TMI, but you know what I mean? I don't have, you know how people, you look at the arms like, oh my God, your arms. I barely have visible hair in my arm. Like you got to really look. Legs, I have not shaved my legs in probably the last 5 to, oh my God, maybe even 10 years. I just haven't had to. It's just not growing anymore. So it's perfect. I've been enabled. 1 or 2 little pieces might come up, but girl, ladies, you know what I'm talking about. I don't have to shave my legs anymore. That's fantastic. And the rest gets waxed. So we are good to go. Armpits wax, everything else wax. Wigs, no. I'm not. I have a wig for the Aunt Lottie show, but I'm not a wig wearer. I've never been a person who can do wigs or braids or anything like that because I'm just a natural girl. I like to keep it simple. I just want to be able to pull it back in one and be happy. And soon I'm going to stop coloring my hair, although I think I might have found a natural hair coloring thing because all these things now, they're like, oh, this is hair coloring tied to cancer, relaxing tied to cancer. I'm like, what? What next? Oh my God. I don't even know. But anyway, go natural if you can. It's not always easy, but I'm here to tell you it can be done. And I love the fact now that I don't spend any more money on razors or anything like that. It's just fantastic. Catherine, you're right, girl. They infected hundreds of Black men with syphilis. Read on the test. That's the one I was thinking about, but I couldn't remember the name of it. The Tuskegee experiment. Yep. They want to know how syphilis. And I'm thinking, why did they even have to do that? Because syphilis has been around a long time. It has destroyed kings and queens and all kind of rich elite people, especially European and even Americans. When they did the Tuskegee experiment, they didn't need to know that information. They had a lot of historical information on what syphilis does to the body. Child, they were just looking for a reason to, experiment on these poor Black people. Horrible. Lavana says, I don't know how I still have hair on my head, the amount that comes out when I comb it, but yes, I know exactly what you mean. Yep. Lose a lot, but apparently retaining enough. So, it's all good. It's all good. All right, folks. So once again, plea to all content creators. Listen, some of you are shy about having your face on camera. Do you know that there are people who create content where your face doesn't have to be on camera? There's a way to do that as well. Just your voice, and you can do animations and whatever. Hit me up if you're interested. If you want to do it, I'm here for it. Hopefully you're here for it, and we can get it done together. All right. Join the CMR family as we grow from strength to strength. You guys have a fantastic day. I am out of here. We will see you tomorrow. And tomorrow we'll talk about the Seaman's Quandry, which is all about how our seamen are at risk. And we have got to pay attention to what is happening in relation to our seamen. Okay. So we're going to share that with you. And I think you're going to want to hear some of the details on that front. Until tomorrow morning, you guys be good, or at least be good at it. Please try not to have any accidents on the roadway. And we will see you all at 7:30 a.m. Here's a few messages from our sponsors.
Infrastructure is more than roads and buildings.
It's our lifeline, connecting East End to West Bay, Cayman to Little Cayman, and the Cayman Islands to the world.
It established the route to get our children to school, keep our hospitals powered, and support our businesses every day.
Through hard work, ingenuity, and perseverance, people make that happen.
From the early pioneers who paved the first paths and laid the first pipes,
to the innovators who modernize water, energy, telecoms, ports, and our airport.
they're the quiet hands that build resilience.
And the vision that keeps Cayman going strong.
Now it's our turn to recognize them. Know someone who built, maintained, or improved the Cayman Islands we love?
Nominate them today at gov.ky/YSCH. Click Nominate today.
And please do not forget, the nomination deadline is tomorrow, the 15th of October. So please get your nominations in.
The Fall Labour Force Survey and Quality of Life Survey conducted by the Economics and Statistics Office (ESO) started on Sunday, September 28th. The Labour Force Survey seeks to collect data on the employed and unemployed persons in the Cayman Islands, as well as those who are not in the labour force. The Quality of Life Survey seeks to gather information on life satisfaction, sense of well-being, financial security, economic outlook, social inclusion, sense of belonging to the local community, and perceived health. Trained interviewers, with ESO ID cards, will visit randomly selected households. The interviews are confidential in accordance with the Statistics Act. No individual data will be published or disclosed. Survey data are exempt from Freedom of Information requests. For more details, please call the ESO hotline at 516-3329, that is, 516-3329,